Hello, Timothy. I hope you're well in Uganda. So, for everybody who's listening, Timothy is our local partner and guide in Uganda. He's very well knowledgeable about his country, especially about the nature, about the culture. And today I will have a brief interview with Timothy about the latest update on the coronavirus in Uganda and especially how it's affecting his daily life and his job as a tourist guide. So hi, Timothy. When did you hear about it for the first time?
Well, in Uganda, when it happened the first time, it was through TV. Yes, we have a local TV station called NTV, and that was the first place to tell us about the first case in Uganda. But around the world, of course, we already had the news from international media like Al Jazeera, which used to broadcast uh, the happenings around the world, how the virus was spreading.
Did you immediately saw that, like, thought it would be a big risk in Africa and in Uganda especially, or you thought it was something in Europe or China or Asia, and it wouldn't affect Africa?
We actually thought it would be contained because we believe because of we believe Europe, Asia has more specialized medication, better equipment, better facilities.
Yes.
They have the hospitals with so many people, and the doctor to patient ratio is very good, which is not the case here in our place. But we
Yes.
didn't think it would ever come here because we kind of didn't know how we could manage such a thing. Yes, we didn't know how, because the way the virus spreads and how we here in Uganda congregate, it's kind of hard to avoid contacts. Yes,
Yes.
for example, our public transport systems, they cram us in very tight spaces, and this is the biggest mode of transport across the country. Yes, so we
Yes.
didn't know how we would really handle it. No one knew how to handle it.
How is this affecting your daily life and your business?
It's not really good. Then, because of the ban on movement transport, the food prices have gone up. And
Yes.
normally you buy, say, a kilo of sugar at $1. Now you have to cough, say, $2, say $1.50. And this is not good for people who live on a budget. Yes,
Yes.
very tricky.
Do you think there is a big gap between people who are living in the villages and people who are living in the bigger cities like Kampala and Tebe?
There is a very huge gap, especially in terms, we start with income. The people in towns, of course, have more income than the people in villages. So when it comes to accessing, say, food, water, the basics that are very important right now in the lockdown, soap, it's easier for the people in urban centers to get them than the
Yes.
people in the rural areas. Then, of course, infrastructure like the hospitals, yes. The rural areas have low-grade hospitals which are understaffed and under-equipped. Yeah, there's little equipment, there's little soap, there's little bed. The beddings are not there. Yes, compared to
Yes.
the hospital in town. Yes, those are, and then the distance to a health facility.
Yes.
In a rural area, the person has to walk a very long distance to access any basic medical help, as
Yes.
compared to town where we have pharmacies, clinics littered in almost all the urban centers. They're just a walk away, you get medical help. So that's why in this lockdown, they emphasize the stopping of movement of people. Yes,
Yes.
because once this virus spreads to the villages, oh, it can be bad. It can really be bad. So
Yes.
most of the cases we are having are in urban centers, and mainly by people who have traveled from outside countries. So there's actually a local saying saying that this disease is for the rich because it comes by the plane. And for
Exactly.
us, the local local people who don't fly by plane. In Africa, we have a very huge health crisis. We have people with HIV, we have people with malaria. Malaria is the #1 killer disease, for example, in my country. Then we also have new diseases. We call them lifestyle diseases. Diabetes, high blood pressure, hypertension, and they are on the rise. We have very many cases. So, and then we have expectant mothers. Now, we have a very sad story, very many sad stories which are coming of expectant mothers dying, young children dying of malaria because of this situation. So we're worried we may lose more people in Africa from these other diseases than from corona. It will be corona-related kind of diseases. Yes, you see how you have very big numbers in Europe from corona. For us, it will be very big numbers of the sick who couldn't access Medicare, the expectant mothers who couldn't make it to the hospital because
of the corona measures. Yeah, I think that's a very important message you're giving here. Because of the ban of the movement, also internationally, I suppose there are no more tourists coming to Uganda, so it means no business at all for you, right? Yeah.
No business, because the lockdown is in both places, here locally and also where we get the guests from. Their countries are also under lockdown.
How do you think this is affecting tourism in Uganda in general?
Now, for example, I'll start with the places most clients go to, the national parks, called wildlife conservation areas. They're all closed. No one is allowed to go in, of course, under these conditions. And then also the accommodation facilities, there are no clients. I mean, they told all the workers to leave, which is really sad. Then the airport is under lockdown. I mean, once the airport is closed, I mean, that is very, very bad for you. Then the worst part is when we have less tourists coming, it means less funds going to help those who are conserving the well-protected areas. So this is giving opportunities to poachers. Yes, especially now that there are fewer rangers who are active, because also not the government system also can't hire all the rangers right now. So we're seeing a case, for example, in our neighboring countries like Congo, they are seeing a spike in ivory. They are killing many elephants now. And yes, and of course they're going to keep this ivory until they open the airports. Yes. So it's really not good. It's not a good thing what's happening right now in tourism.
Yes, exactly. Do you think we will feel the consequences on the longer term?
A lot of mouths are fed from tourism. Tourism is a mother to very many people here. So maybe in the long term, that's why I think we project a situation where people want to travel because they are tired of what they've seen. We have like situation in Italy where it's really bad. We think some of these clients will want to move more just to relieve the pain and to get a fresh atmosphere. So we kind of think that after this lockdown, once people start to move, we think we might get an explosion of tourists here. Africa and Uganda would be a nice place to soothe and to relax and to forget. If we would be a therapy kind of tourism, which I believe would work so well. Nature is the best therapist. Even a walk in nature, no matter your stress, you feel much better afterwards.
Yes.
Yeah.
All right. Yeah. Okay. Okay. Yeah. Thank you very much for this conversation, and it was very interesting to learn a different side from a different part of the world. So thank you very much, and stay safe.
Stay safe too.